this critical care assignment, I decided to going over student Dr. Eason's PowerPoint he presented in the class. This topic is regarding intracranial hemorrhage. So in his slides, he pretty much separated into pathology, and he include one board style question. He separated the intracerebral hemorrhage into trauma related and cerebral vascular related. I think that's a fair categorization. And for trauma related, he further categorized it as epidural hematoma and subdural hematoma. And for cerebral vascular disease, he included the intracerebral hemorrhage and the subarachnoid hemorrhage. This is his slide for intracranial hemorrhage. I think he did a good job on summarizing it. The only thing I would add on to his slide is for patient who is taking blood thinner, it's a higher risk for such as warfarin, and also for patient who has signs of symptoms of intracranial hemorrhage, we need to monitor their intracranial pressure. This slide is about subarachnoid hemorrhage. I like how he summarized into like board style. Patient often complain worst headache of my life, and it's often associated with Marfan syndrome and polycystic kidney disease. I think those are fair. I would add on to it, patient often has neck stiffness and photophobia and nausea, vomiting. Also, the first line of detection should be non-contrast CT. That should be the initial test of choice. He did mention here about lumbar puncture. I think that's only when because I think the head CT start to lose sensitivity after 6 hours. If the suspicion index is still high, we can do a lumbar puncture and watch for the yellow color CSF if that's we still suspecting subarachnoid hemorrhage. Also, I want to add on for treatment, it's to use calcium channel blocker such as nimodipine to prevent vasospasm, and also we can do endovascular coiling or surgical clipping of the aneurysm to prevent further bleeding. The complication of subarachnoid hemorrhage is vasospasm, and that usually happens around 3 to 14 days after the event. Also, rebleeding and hydrocephalus. For epidural hematoma, I think he summarized fairly well on here. And the rupture of middle meningeal artery, I think I see that on the question bank a lot. And the lens shape lesion on the CT. Subdural hematoma, this is bleeding below the dura, and rupture of bridging veins. I think he did a good job summarizing this as well. And I think for both of the hematomas, um, the treatment it's mostly it's related to how severe the symptom is. If the patient has severely increased ICP, we need to consider surgical option like craniotomy. I'm not sure if I say that right. And I really like he include the CT pictures um, and just list them all together in one slide. Um, and his board style questions. Um, I like how he presented as like the final touch up um, for us to think about. Overall, I think Ethan did a very good job on his PowerPoint, and this is my summary.